welcome. I'm seeing a few familiar names from our webinar from a month ago, so thank you again for joining again. I will not be diving in as much detail as we did last time into the technology. So for the attendees who have not been able to join last webinar, feel free to send us an email. There is a recording. Irina will be happy to share that with you, so you can find out more about the technology. Just a quick disclaimer, as you can probably tell by our attire, we're Zeto logoed. We're all employees of Zeto. We're a manufacturer of EEG products for clinical use, and we'd be showcasing our product today. I'm first going to go over active dry electrode technology and Zeto Cloud Platform very briefly. I'm trying to cover this within 5 minutes, what last month we needed about an hour for. So I'll do my very best to do this in 5 minutes. Then we'll talk a little bit about clinical applications, case studies, and then John will talk about the training and onboarding that we are providing at Zeto. Now, this is supposed to be a very interactive meeting also, so type in your questions. And Irina, if you find a question relevant for the slide I'm talking about, just make sure to mention it. We can also answer certain questions right away. Sometimes it's better than waiting till the very end. But if we don't get to your question right away, we will have a dedicated time at the end. So let's talk a little bit about a technical summary. If you have not seen active dry electrodes before, then you'll probably just recognize it looks very, very different. So from what you're used to with individual lead wires that you individually glue or somehow attach via caps or other means to the head, that goes to a head box, and then you use a computer, and it's a little bit of a production to get it going. And then compare this to an active dry EEG system. It's a lot smaller in form factor, but also has a lot more technology in it. It really requires chips that simply weren't around 30, 40 years ago. So the approach we're taking here was simply not possible until maybe the early 2000s. If we just really briefly look into the schematics of what a passive, aka traditional system looks like. So everything that you've learned about in EEG tech school and that you're applying right now in clinics is using something called a passive lead system. So you have a longer lead wire, and the longer the wire is, the more noise it picks up, because it's a big antenna. You know that you're picking up 60 hertz line noise or 50 hertz when you're in Europe. And in order to get a strong signal, you have to reduce your skin impedance, so you increase your signal to noise ratio. Otherwise, you're not able to record much. Now, there's other technology that also gives you a shielded wire, so it shields you a little bit from noise. But at the end of the day, you always have to use long wires. You always have to reduce your skin impedance to under 10 kilo ohm to get a really nice signal to noise ratio. And that takes time and takes a lot of skill also. Now, comparing this to what we are doing, so a traditional lead-based system has an amplifier with a whole bunch of preamps and other components built in this box, and sometimes in a separate amplifier unit. And then you have a long lead wire. So this is a metric system, 120 to 180 centimeters. But think about it, your standard length cables. They're big copper wires inside long, and you put a gel or paste underneath the electrode disc or pin or ring, whatever you're using. And you're preparing your scalp to get a low skin impedance. The trick with a dry active electrode system is that we are moving part of the electronics that are usually in the head box and close to the amplifier. We're moving those right on top of the electrode. And with that, we are pre-amplifying the signal to such a degree that you do not need to prepare the scalp. So the moment the electrode touches the scalp, that is when we have a strong signal that's good enough for clinical EEG. Now, as a result, we pre-amplify the very tiny signal on the scalp. And even with a longer lead wire, since the signal is strong already, we are picking up noise, but the ratio, the signal to noise ratio is a lot better. And as a result, we do not need to prep the scalp. And we have also some other nice features like noise cancellation and shielding attributes because of moving the amplifier closer to the scalp. The takeaway really is that a active dry electrode system like the one that we are distributing enables users to get excellent data quality within a 5 minutes setup time without the use of gel, without the use of pastes. And that's what our system looks like. Looks a little bit like a bicycle helmet, comes in a carry case. It's nice and handy to move around. Now, if you compare Zeto versus traditional lead EEG, and that's recorded on the same patient at the same time, with the electrodes about an inch apart, so they shouldn't be touching, they shouldn't have a galvanic bridge. If I wouldn't tell you that the left was recorded with a Natus Exotech lead-based system and the right was recorded with the Zeto, you wouldn't really know. Neither did the epileptologists and EEG techs that we showed this during the FDA assessment. We double-blinded this, submitted this, and you don't really know which one is which because the signal fidelity is equivalent. Here's another way of looking at it. Here we've overlaid these type of recordings where the black tracing is traditional EEG and Zeto EEG is a red tracing. And keep in mind, it's not identical because it's not 100% on the same location. It's about an inch apart. And, if you change your location, you change your amplitude and some attributes. But if you wouldn't know that one is dry, the other is gel-based, there's no way to tell this apart. This is another way of looking at it. Now, I'm looking here at a referential montage that's not bipolar. That's simply for these type of comparisons, it's a little bit cleaner to have a referential montage. But okay, awesome. So I want to spend one slide talking about the cloud because that's what a lot of people are not aware of. It's a lot easier to put a picture online of a headset, and yes, we have it. It's great. We love it. But a lot of the features that our users really appreciate are within the way we handle data. We make data available for users to access conveniently and safely, and for the second and third order benefits that come from that. So the EEG headset streams the data in real time to a centralized cloud. We're HIPAA compliant. We have a whole bunch of cybersecurity clearances, and you can access the cloud with pretty much any control device. It means any device connected to the internet. If the screen is good enough, there's no limitation. So I've had some physicians look at it on their large smartphone, and they were actually happy with it. But of course, the larger the screen, the better. You can do this on macOS, you can do this on Windows platforms, tablets, you name it. And it's really just a Chrome browser, and maybe at the end we can log in to show you. And you authenticate yourself, and then you see the data stream to your terminal within 100 milliseconds. And you can interpret that yourself, or you can monitor yourself as a tech. Your facility, if they don't have physicians to read it, you have a physician reading service. And if there are not enough EEG techs around to monitor for live monitoring, we also have a nationwide monitoring service staffed by registered EEG technologists. The main point I wanted you to see here is that the product is connected to our cloud, streams in real time to your own set of providers. That might be yourself or your physicians, or if your facility doesn't have complete nighttime coverage and you simply need some sleep, then you also can get somebody from our third-party monitoring or reading service to help out. So let's talk for a moment about the intended use. And with any clinically cleared product, it's always about what there's an on-label and off-label use. The on-label use, the one that this device is intended to for clinical applications. And I just took a screenshot here. you can find this online on the FDA website, is for EEG within a healthcare facility or for clinical research on adults and children. So we are ranging head sizes between 48 to 62 centimeters head circumference. It needs to take place in a healthcare facility operated by a healthcare professional familiar with EEG. I'll talk in a moment about what that phrase means. And we're cleared to record EEG, ECG, accelerometers, photic sensors to register your photic stimulation, external triggers like your patient buttons, and video integration. What we're not cleared for is application of newborns, ambulatory, at-home recordings, or anything that's not covered by the cleared use. We have certain form factors in our headset that make us not conducive to usage in other areas, even though it's not specifically prohibited. So we are cleared for EEG. There's no time limit to that. But as John mentioned, our battery runs out at some point. So after around 5 to 6 hours, you either switch to another headset or you move on to another way of recording EEG. We need patients with intact skulls. So our form factor is not conducive to patients with missing skull. So that excludes certain number of patients and patients with interfering devices on or in the head. So if you have tubes, portholes, whatever, and that interferes with the placement of our device, then that's also not a patient you should be using Zeto with. Also not for polysomnography or use during walking. Our form factor is not conducive to this. And a lot of what we'll be talking about, keep that in mind. So I don't want you to misunderstand that we imply usage elsewhere. So we're not good for EMUs. We're not good for these long-term 72-hour studies and those type of things. We are not here to replace the entirety of EEG. We're simply here to fill a gap that exists in many clinical operations where there simply is no 24/7 coverage. And better than most, time is brain with these patients. And what do you do at 2 a.m. in the morning when you as an EEG tech might still be at home and a patient needs to be assessed because of altered mental status, because of needing to exclude non-convulsive seizures. Sometimes, and I'm not sure how that works with your facility, but we hear wait times anywhere from 4 to 8 to 12 hours before patients get their first EEG. Especially during off hours and weekend hours. That's a real concern for patients. So moving on to the actual application areas, with these cleared intended use cases in mind, that puts Zeto into 3 locations. Obviously, main campuses, I say EMU here. If you have an EMU and you have techs that are working in an EMU, as a tech, you might not want to be pulled away from the actual EMU use for a stat EEG. You want to pay attention to the EMU patients. So Zeto has a useful application there to kind of help reduce the noise and help reduce the workload on the techs. So if you have a triaging request, you can do that using Zeto and keep your time focused on the EMU. So we're good in reducing transfer costs because you can triage patients better. We're good in reducing delayed patient discharges because you can get the exit exams done quicker. Sometimes on-call costs are reduced just because you can exclude the need for somebody to come out in the middle of the night if you can see, okay, the patient is good to go. We don't actually need to worry about this patient. Tech workload is clearly reduced. Burnout is a big topic in the EEG tech community, especially in smaller rural areas. If you might only have a handful of EEG techs, they're being called for everything at all hours of the day. And of course, patient wait times are reduced because setup time is much, much shorter. So that also puts us in inpatient emergency situations, so that's ICUs, inpatient less emergent situation that might be just regular monitoring if somebody's been there for a while, and obviously outpatient clinics. So all of your routine EEGs you can cover with this.
Great.
So these are just some images from hospitals. Um, in the ICU inpatient application, please notice that we do require a towel roll in the neck. So to prop up the headset, we don't want it to touch pillows and the neck rest. And we do want to see a little bit of an incline, so completely patient lying down flat can be challenging. But in ICU situations, and especially in PICUs, very often we hear that the patients are sedated. So that actually helps us a good amount. Now, you're right, combative patients, non-compliant patients can be a concern, like with any EEG. If they're able to grab an electrode and they yank it out, they'll certainly have something to hold on to when they have a Zeto system on the head. So we always say the best use case for Zeto is if you have consciously or unconsciously compliant patients. So they're either compliant enough or they're sedated. Now, at the same time, they're empowering their EEG technologists to not always have to be on site. Because very often we can cross-train other technologists also, which does not mean that EEG techs become obsolete. That simply means that the EEG techs that the hospital has, they can use a lot more efficiently. To this date, we have not heard of a hospital parting ways with their EEG techs because of Zeto. It's been quite the opposite. It's been empowering the technologists to be more available and to maybe even monitor more patients, because your ability as an EEG tech is more than simply hooking up wires. It is a crucial, integral part of your skill set, but your several month training is a lot more than just that.
Florian, I also noticed that Leisha Osburn, one of our partners, was able to join. Hi, Leisha, and maybe we'll ask her a few questions and then we'll go back to training and onboarding.
Yeah, that's a good idea. I just wasn't sure if she was able to hear us. Alicia, are you there? Alicia, can you hear us?
I can. Can you hear me?
Perfect and wonderful. I wasn't sure if you're still on the call, so thank you so much. And maybe you can provide some perspective on about your experiences with Zeto.
Yeah, I'd love to.
Yeah.
But first of all, I would like to introduce Leisha. Leisha is our partner, CEO, and co-founder of Next Gen Neuro, an amazing company that provides a remote EEG monitoring. And I think that all ACID community knows Leisha. So, Leisha, please.
Well, thank you for that introduction. I'm sure there are folks on the call who don't know me. Actually, we partnered with Zeto because I'm always looking for the next new thing. And so every year I go to these asset meetings and I look at the new technology. This has been going on for 20 years. And every time until recently, I've always walked away, shoot, we're still not really there yet with advancing our technology. And, I still remember the talk that Mark Stecker gave as a keynote speaker at Asset, probably 7 years back. And he talked about how things really haven't changed for 50 years. A few more electrodes, a fancier way, not ink and paper anymore. And he also mentioned that there are these new dry electrode systems that are coming out, and that we have for some reason resisted moving in that direction. And I thought to myself, well, yes, every time I've taken a look at one of those, I've been disappointed. And then I went to the Zeto booth one year, and I thought, oh my gosh, this really works. And so after that time, we've revisited many times. I remember even we had a marketing person at the booth, and she had walked across and started talking with the folks that were at the Zeto booth. And before I knew it, I looked across the room and I saw her EEG up on the screen. So for us, that was a clear indication that this may solve a problem that we see frequently at Next Gen Neuro, because we hear from the hospitals that may not have any EEG techs, or may have EEG techs, but maybe just one or two, and they are not able to offer 24/7 coverage, and so they have ER doc or folks within the providers within the hospital that would like to not keep patients just to get an EEG. They want to discharge them as soon as they're, as it's realistic to do so. And they would like not to lose them in follow-up. If a lot of patient populations, you discharge them from the hospital, you're not going to get them to come back and do another diagnostic study, down the road. And so we found when these places call, a lot of times they've already pulled in allied health professionals within the organization. So this could be nurses, this could be respiratory therapists, this could be cardiopulmonary techs, it could be CNAs or LPNs. And the spectrum of places within the hospital that they have been asked to do EEGs runs the gamut. So all the way from the ICU setting to the emergency room to outpatient areas. And they often have old equipment. It was kind of taught to them, but what they know for sure is that until they were, had this promise of a Zeto system and support, that they were always uneasy. Even though we see them as taking over our jobs, they really didn't want our jobs. The hospital simply said, you're going to do this. And they have so often expressed such great relief at the idea that what we can provide for them is coverage 24/7 to hop on with them, help them set up a Zeto appropriately to get a high quality recording. And they also know that if there's something that's going on that screen, it's not them who has to worry about whether, is that something I should call a doctor about? Because they know that we'll take care of that for them. So we actually not only help them set up, but we remotely run the study through the Zeto cloud. And you might be thinking, well, that's great for you and your company, but that doesn't help me. I'm the in-house tech. How does this help me? And I know that Florian identified a great list of ways that it helps you. One thing that I just want to call out is that just like the way our registered techs remote in and run those studies remotely and make sure the quality is good, wouldn't you all like to take call from home and not have to go into the hospital and set up a patient? So what if you're the remote tech who is able to log in from home to cover an after-hours study at your hospital that maybe a nurse in the ER is going to set up, or a medical assistant in the ER is going to set up for you? And so that's exactly what we've been able to do. It works for us, it works for you too. And because the Zeto Cloud is such a secure, easy platform to use, your IT guys are happy, your physicians are thrilled because they now have that extra layer of knowing that quality is managed appropriately and that they're not going to open up a study and then go, oh boy, I'm going to have to address quality, because they know the EEG tech is already going to take care of that before they're on the scene. So what I have seen this as someone who's always trying to advance the highest end of our field, and some of you may know, I've been very involved in the new neuroanalyst credential and moving that forward and moving, allowing opportunities for us to be recognized at that very high level of performance. I've also been a strong advocate of there being a place for us all the way across the spectrum. And so this now allows all of us to have an opportunity to invite others into the field, because you know what happens, some of those LPNs, those CNAs, even respiratory techs in one case, they're like, wow, this is a really cool career path. Could I do this? Can I see about joining your field, having this as a career? And we have sent them to those online schools that are very well established now, and they've entered our field. And so this allows a pathway in at the beginning tiers of our career path. And it also allows acknowledgement of that very high-end level where we're the person that is at home contributing our expertise for that EEG in a very appropriate way. And it's the most exciting thing I've seen in a long time. So I just thank you all for listening to that. And if you have any questions, please ask.
I think Leisha did this better than I could ever do this. Takeaway really is gold standard remains the gold standard. So EEG techs are still the gold standard for a lot of things, but there are a lot of different ways of how changes and improvements in technology can also lead to improvements in your roles. And we see this anywhere from becoming educators to cross-training within neurodiagnostics field to getting additional credentialing and just making your jobs easier. We see that as an opportunity to improve the status quo and move on to something that's more easy for everybody and provides faster care for patients. Everything else, I think Leisha put on the point even better than I could put this on the slide. But we are really here to support the EEG tech community and service a common goal of getting this life-saving tests to patients faster, more efficiently, and in many cases also cheaper.